What happens if your thyroid FNAB is non-diagnostic? Have you ever wondered what it means if your thyroid fine needle aspiration biopsy is non-diagnostic? A non-diagnostic result indicates that the sample taken from your thyroid nodule does not have enough cells or adequate material for the pathologist to make a clear diagnosis. This can occur even if the needle was placed correctly in the nodule. Sometimes, the sample may consist mostly of cyst fluid, excessive blood, or not enough follicular cells. When faced with a non-diagnostic FNAB, the typical next step is to repeat the biopsy. This is because the first sample did not provide useful information about whether the nodule is benign or malignant. It is quite common for healthcare providers to recommend a repeat FNAB to obtain a more adequate sample for diagnosis. If the second biopsy also comes back non-diagnostic, there are several management options available. These may include performing a third biopsy, closely monitoring the nodule with ultrasound, or considering surgical removal of the nodule. The decision will depend on various risk factors and the ultrasound features of the nodule. Ultrasound characteristics play a crucial role in guiding what happens next after a non-diagnostic FNAB. Nodules that appear suspicious on ultrasound are more likely to requiring a repeat biopsy or surgery. Conversely, nodules that show low suspicion or are mostly cystic without any suspicious features may be safely monitored with ultrasound instead of undergoing an immediate repeat biopsy. In summary, a non-diagnostic FNAB means there were not enough cells for a diagnosis. A repeat FNAB is usually recommended to try to get a diagnostic sample. If the repeat FNAB is also non-diagnostic, options include further biopsy, close ultrasound follow-up, or surgery based on a risk assessment. Nodules with suspicious ultrasound features may indicate a higher likelihood of malignancy, prompting more aggressive follow-up. On the other hand, nodules that are mostly cystic and lack suspicious features may be monitored without an immediate repeat biopsy. This approach aims to balance the need to avoid unnecessary surgery while ensuring that thyroid cancers are not missed. It is essential to have a personalized assessment by an endocrinologist or thyroid specialist to determine the best plan after a non-diagnostic FNAB. Always consult with your healthcare provider for tailored advice based on your specific situation.